Edenslivingtv coming to you. This article came through my email, and I went, you know what? I'm having a lot of clients having this problem of late. So let's talk about it. Frequent urination, where you feel like you have that tendency where either you can't empty your bladder or you just have this feeling that you have to go all the time. So let's talk about some of the symptoms of frequent urination. Of course, everybody's different. It depends upon your age. When you get older, your bladder gets weaker and you have prostate trouble if you're a man. But the average person's urinary frequency is typically between 6 to 7 times within 24 hours. And I can tell you, as someone that had interstitial cystitis, even had to go get cauterized, I used to pee every 10 minutes. Like, I felt like I never emptied my bladder. So a normal person can have between 4 to 10 times a day, as long as the person is healthy and feels happy. Guys, you also have got to really drink your water to flush your kidneys. If you're not drinking a lot of water to hydrate your brain and your body and flush these toxins that you're exposed to, between the chemtrails and the modified food and all of the chemicals and the waxes and the pesticides and the herbicides, and then you're putting the aluminums of your deodorant. I don't use aluminum deodorant, but think about all the toxins that you have, and this all builds up in the body. And if you drink a lot of water, you flush these things out. You could have frequent urination due to a UTI, an infection. You can naturally address this. I'm not a doctor. I'm not treating, curing anything. But you can naturally address UTIs with D-mannose. That's D and then M-A-N-N-O-S. You could be having nerve-related problems. Like right now, I know on my car wreck in my lower back, I'm having bladder problems and feel like I have to pee all the time because I've got a lot of nerve-related problems down there, and I have a lot of inflammation. Did you realize your caffeine intake affects your frequency? Enlarged prostate can make you have to go to the bathroom a lot. Vaginosis, inflammation or infection of the vagina, especially if you're having a lot of sex, not having clean hygienic practices. You can get vaginosis several ways. But again, if you have vaginosis, that is all by the bladder. You have a neurogenic bladder. What in the heck is a neurogenic? In my case, where the nerves are affected, the organ that stores and releases the urine, your bladder, it can be damaged due to injury. In my case, a car wreck. It may cause the muscles in the bladder not to work properly. Kegel muscles, doing core exercises, strengthening your abdominal wall, your bladder wall. All these can help. These muscles are overactive and squeeze the bladder too frequently. This results in more frequent urination. This is an issue with your bladder muscle. Could be related to spine issues. Again, regular chiropractic adjustments. I do biofeedback to get my spinal energy going. But infection can be caused by bacteria entering into your urethra. Make sure when you're going to the bathroom, you hygienically wipe from the front to the back. It's amazing that not many people know that. It's amazing. I thought everybody knew how to wipe. No, it's front to back. You may have cloudy or bloody urine. If you have bloody urine, or pain with urination, you have an infection. You need to go, get you something like D-mannose, or I do a combination of like apple cider vinegar, lemonade. I do a lot of herbal therapies. I put essential oils on my bladder and on my womb and my all of this front area. Caffeine can be a bladder irritant, and I've been drinking lots of coffee, and now I just put 2 and 2 together going, wow, I've been increasing coffee due to a lot of stress and just things going on. So I'm not only getting the caffeine to irritate my bladder, but I'm also getting my pH balance off. An enlarged prostate can cause these bladder problems. If your prostate's big, it may block or irritate the bladder, causing a lot of frequency. Men are like, my prostate swollen. Vaginosis, again, the vagina or vulva, the external genitalia, it becomes swollen, irritated, cause pain, desire to urinate more frequently. You can have a urethra, the tube and the urine passes from the bladder to the outside. You can have swelling, you can have anxiety. Pregnancy issues can increase urination. Alcohol, overactive bladder syndrome, We have frequency all the time of having to go to the bathroom. Spinal issues. You might have a tumor in your pelvis. You might have bladder cancer. As I said, interstitial cystitis is what I had, and it was, guys, it was awful. I had to be put to sleep once a year for them to go and put in like this coating to calm my bladder down. And now I know that I've been implanted with medical devices, so it was a research study too. Diseases of the nervous system. Right now, my nervous system is deregulated due to a lot of stress in my life and a lot of toxic people that I'm working to process that out of my mind and life. Medications, let's talk about diuretics. Of course, going to make you pee if you're on a high blood pressure medicine and they've given you a diuretic, giving you the diuretic as your blood pressure medicine. Make sure you're taking vitamin K with that. And I am speaking as an ex-biotech, cardiovascular, respiratory, pharmaceutical expert. I did pharmaceuticals for 6 years. You can also have overactive bladder from stress, incontinence, linkage of the urine. Sometimes I can't make it to the bathroom. Puts pressure. Sedatives or muscle relaxants. I used to live on Xanaflex or Valium. If you do this, you're absolutely affecting the muscle tones of your body, and you can cause frequent urination. So how to treat the frequent urination? Of course, I'm a naturopathic person. I do D-monos. I do essential oils. I do like lemons to get in there, and cranberries with certain types of herbal reliefs. But you might have to have antibiotics. Do not play around with UTIs. You can die of a kidney infection. If you have a prostate that's enlarged, you might have to be, medicated. You might have to have surgery. Vaginosis. You might need a cream or suppository. I do coconut oil. You can make your own. You can do yoni steams, putting a herbal tea, sitting in a chair with a hole in it and steaming your vagina. Yes, you have parasites in your vagina. You have bacteria and things in your vagina. It needs to be cleaned. Frequent urination is accompanied with incontinence. It may be helpful to protect clothes by wearing like pads. If you have a lot of control problems, you might want to wear a little. But make sure when you wear these pads, they need to be organic cotton, not the ones filled with Roundup that's in pesticides that's going to cause more problems. Avoid a lot of fluid right before you go to bed, and avoid alcohol and caffeine may also help. So this is just an overview of why you might be having all of these problems. You can go get a culture. You can go get a urinalysis. Cytoscope, where they put the surgical procedure, looks up in the urethra and bladder, which I've had to have done. Cytometry, which measures the pressure in the bladder. Cystometry, gynecological pelvic exam, or ultrasound to see the waves to produce an image to see if you have any tumors in your pelvis at all. And the abdominal ultrasound can also. If you have frequent urination with any of these symptoms, immediately call your healthcare provider. If you're vomiting, if you have chills, shaking, pain in your back, again, this could be major infection. Fever, accompanied with this sudden weight loss, increased appetite, or increased thirst. Increased thirst is a huge indication of kidneys or either diabetes. Vomiting, incontinence, where you unintended release of your urine. Blood in urine, you got to go to the doctor. Cloudy urine, you probably got an infection. Discharge from your penis or vagina, and symptoms that are interfering with your daily life. In summary, as we've talked about the frequent urination, it involves a person that just feels like they go to the bathroom a lot. And again, 4 to 10 times a day is natural. Varies. If a person consumes 2 liters of water daily but urinates more than 7 times, you may be dealing with frequent urination. So that is a very good indicator. If you're going more than 10 times a day, you need to have something looked at and addressed. May cause by infections, medication, nerve damage, and other medical problems. You might have to do a lifestyle change. As I said, no more caffeine, the alcohol, limit or get it out. Medications could be causing problems. Talk to your doctor. If you're a man with an enlarged prostate or urethra damage where there's narrowing, like when I was a little girl, I had a surgery at 3 years old. They had to go in and repair my urethra. So a little shout out to Very Well Health. I really like getting their emails. It gives me ideas for things to teach on. I usually teach on things that either I'm working with a client or going through my life. but I will let this go. We're going on 10 minutes here. Now, guys, you can treat things naturally. You can use essential oils and herbs. You can do biofeedback. If you want biofeedback consults, email me, Edenslivingtv, EDENSLIVING TV @gmail.com. You can heal.